You're 9 years old. Very good. Do you know where you are?
Barnesville,
Minnesota. Okay, very good. And do you know why you're here today?
for a wellness check.
Perfect. And who's the President of the United States?
Donald Trump.
Okay, very good. Okay, so Lillian is alert, orientated, knows where she's at. She's dressed appropriately for the situation. She has a cute tank top on and shorts. It's 90 degrees outside, so that's perfect. Her hygiene is very good, and she's not in any distress or any discomfort of any sort. Okay? So the next thing is when she first came in, we checked all of her vital signs and we got her weight and her height. So she is 4 foot 5 inches, and she is 88 pounds. So it puts her for height, she's in the 31% percentile, and then for weight, she's in the 91 percentile. And we talked about your reproductive stages and your Tanner type 2. Okay, so Tanner stage 2. Okay, and then her vital signs, her blood pressure was 120, 100 over 80, and her pulse was 98. And her respiratory rate is about 18. So she's real relaxed, no distress or anything like this. So those were her vital signs really quick. The next thing that we're gonna do, Lil, is I'm gonna touch you and I'm gonna feel your skin and I'm gonna look at it very closely, okay? So as I'm touching your skin and feeling it, I'm noticing the texture, the color, the temperature. It's nice and pink. She's Caucasian. It's perfectly, for her ethnicity, it's perfectly even. As I'm looking down here, and, oh, looks like you got a skinned elbow. What happened here?
I fell off my bike.
You fell off your bike? Okay, very good. All right, we'll note that on your left elbow. Okay, as we're looking down, looks like you got skins on your knees and some bruises. Same accident?
Yeah.
Yeah, okay. Do you always wear your helmet when you bike? Okay, very good. Yep, I always do too. Okay, so now as I'm looking, we're gonna document that she's got a couple little abrasions on her knees. But other than that, her skin, the texture is very good. Now we're gonna look at her hands. I'm gonna look for any tenting. She's hydrated appropriately. And I'm looking at her fingernails, and the cap refill is very good. Okay, so that's good. That means your peripheral vascularization is good. Can I see your teeth? Looks like we just got one growing in. And you go to the dentist 2 times a year, you told me?
Mm-hmm.
Yep, okay, very good. Okay, so, all right, so now we're gonna move onto her head. And I don't see any lesions or really any abnormalities other than a couple skins and bruises from a 9-year-old girl that was on a bike. Okay, so as I'm gonna touch your head, okay, and I'm feeling through your scalp. Very good, I don't notice any nodules or any lesions, and I'm feeling her hair. It's silky texture, beautiful blonde. Looks like you got a new haircut, very nice. And it's evenly distributed, her hair. So the next thing I'm gonna do is I'm gonna look at her eyes, okay? So, so we did her hair and any nodules. So from when I'm looking at your eyes, I'm looking at your eyelashes turned up, everything's turned up. There's no ptosis, there's no drooping of her eyes, there's no redness, erythema, swelling of any sort. I'm gonna look at your conjunctiva, so I'm gonna pull down here. And palpebral and bulbar conjunctiva, everything looks good. Now I'm gonna look at your sclera. If you look this way and look that way, perfect. The whites of your eyes are perfect, okay? The next thing I'm gonna do is I'm gonna look in your cornea, and I'm gonna look real quick, and it looks like it's clear. There's no scarring, arcus, or lesions. I'm gonna look on the other side. No scarring, arcus, or lesions. Okay, now we're gonna look at your pupils. Your pupils are measuring at 3, okay? And this is called direct. So we're gonna, pupils equal reactive and round to light. Let's see if they react appropriately. Yep, perfect. Very good. So the direct was very good. Now consensual is they would each, when one reacts, they both react. And I'm gonna go like this and hold. Very good. Very good. Consensual response is perfect. Now we're gonna look at accommodation. Look at my finger, look at the wall behind me, look at my finger. Very good. Both your pupils reacted appropriately. Now I'm gonna take my ophthalmoscope and I'm gonna turn it on. My diopter is 0. If I was gonna adjust it, I would use my index finger here. But I'm gonna look right into your pupil, okay? right hand, right eye, your right pupil, okay? I'm gonna get really up and close and personal, okay? Oh, make sure I'm on, yep, okay, here we go. 1, 2, let's get up in there. Okay, perfect, the red light reflex is perfect, okay? Your macula, your vessels, vitreous body, cornea, optic disc has nice margins, that's perfect. Now we're gonna go left, your left, okay? And I'm gonna come in at 15 degrees here. Oh, sorry, well, you're doing great. Oh, yep, perfect. Very good, very good. So vessels, cornea, vitreous body, macula, red light reflex, perfect, good shape, okay? Now I'm gonna turn that off. Now we're gonna check your visual acuity. Okay, so now we have, this is our Snellen eye chart. So I'm gonna go 24 inches away from you. I'm gonna have you read the bottom line for me, or read this, the lowest line that you can. Cover one eye though. Perfect, go for it.
L, T, F, P, H.
Very good, other side.
L, T, F, P, H.
Okay, let's look at this. Perfect, 20, 20, awesome. Okay, so that means that you have perfect vision, okay? Now we're gonna check your visual fields. So, my left, your right. Okay, put your hand over your right. Now what I'm gonna do is I'm gonna, tell me when you can see it.
Yeah.
Okay, this is the static finger wiggle test. I can't even say it. Okay, now we're gonna switch. Okay, ready?
Yeah.
Very good. Okay, so now we did that. Now we're going to check for extraocular eye movements. This would be cranial nerves 3, 4, and 6. So I'm going to have you follow my finger. Ready? Very good. So there's no signs of nystagmus, nothing that we need to worry about. Nystagmus is like the beating of the eyes, and some people have that, but yours were very, very good. One more thing are your beautiful irises. They're uniform and they're beautiful blue, so they're perfect, okay? Now we're gonna go to your ears, okay? So first I'm gonna look at your auricle, okay? And I'm just gonna look at the front and the back, and I'm just gonna visualize front and back, and now I'm gonna feel your auricle. I'm gonna feel your mandible. Do you have any pain there, sweetie?
No.
No? Okay, very good. Now I'm gonna look internally, okay? And I don't see any lesions, cerumen, any drainage, or anything like that, okay? All right, the next thing that we're gonna do is we're gonna look inside. We're gonna look in the tympanic membrane. So right here, I have my otoscope, okay? And I'm gonna look inside, okay? So I'm gonna pull down and back, okay? So you ready? Down and back, very good. Tympanic membrane, pearly gray, 7 o'clock, cone of light, incus and malleus. Yep, I can see pretty good. Okay, any pain with that?
No.
Okay, other side. Pull down and back. All right, I can see your tympanic membrane, your incus malleus. Cone of light is at 5 o'clock. And no redness, erythema, any swelling or any sort, and any pain?
No.
Okay, now we're gonna do a little sound check, okay? This is called the Weber test, and I'm gonna put this tuning fork on your head, and you tell me if you can hear one ear better, okay? Same, different, better?
Same.
Okay, very good. Okay, now the Rin test, I'm gonna put it behind your, on your occipital bone, okay? And you tell me when you can't hear it anymore.
No.
Okay, these tests, the Rin test is timed, so I don't have my watch, but we would time it accordingly. Okay, ready? Feel it?
No.
Okay.
No.
Okay, very good. Okay, so they're both of them are very even. Okay, so that was the Weber test. Okay, the next thing that we're going to do is the hearing test. Okay, this is checking your cranial nerve 8. Okay, so I'm going to whisper in your ear, and I'm going to say something, a 2-syllable word, and you can say if you can see it back. Okay, Okay.
Apple.
Apple. Very good. That means your cranial nerve 8 is working very good. Now we're going to look at your nose. Okay. So we got everything done on your nose. Now we're gonna, or excuse me, your ears. Now we're gonna look at your nose. So I'm looking on the external part of your nose. Everything externally looks good. Feeling your maxillary, any fullness or pain in your frontal sinuses. Anything, any pain, sweetie?
No.
No. Okay. Very good. Okay. Now we're gonna look in the internal part of your nose. Okay. Okay. I know it's been a long day, huh? Okay, you're doing great. So I'm gonna lift up and back, and I'm gonna go up and back, and I'm looking at no deviation, perforation. Your turbinates are nice, pink. No lesions, perfect. Now the other side, I'm gonna look up. No deviations, perforations. Your turbinates are nice and pink. No lesions, no mucosa, or no drainage. Everything good with that?
Mm-hmm.
Very good. Okay. Okay, now we're going to move to your mouth. And I'm going to look at your lips. Can you smile for me? Very good. I don't see any drying, any cracking. They're beautifully hydrated, nice and pink. Okay. Now we're going to look inside your mouth. Okay. So I have here this. Here's my pen light. Okay. So, all right, we're going to open your mouth, and I'm going to push down and go, ah. Oh, perfect. Your uveal or rose midline. I'm looking at your tonsils. There's no exudate, no swelling, no erythema, lesions, anything noted. Very good. Can you lift your tongue up? Very good. Sublingual. The salivary glands are working perfectly. Everything looks very good with that. You can put it down. Yep. Okay. Now I'm going to look inside your mouth here. Okay, ready? This isn't quite as bad. Okay, looking at your buccal mucosa on both sides. I don't see any lesions, erythema, any redness, any swelling, anything that's abnormal. I see one tooth that has a cavity in it that's got a filling. That's very good. So you just got to keep up on your oral hygiene. So we did your tonsils. Oh, and we're going to, the posterior pharynx, that looked good. There was no redness, no erythema, swelling. Your tonsils look good. They're 1+, so that's very good. Okay. And now stick out your tongue for me. Perfect. Come on, there you go. Good. Yep, that means cranial nerve 12 is working perfectly. And as I'm looking at your tongue as you're sticking out, you have some papillary and a little bit of white coating, but that is normal. Your tongue looks normal. No lesions, no edema, erythema, swelling. Kind of hit the eye of your tongue. Very good. Looks good. Okay, now we're going to move on to your neck. Oops, drop this. We're going to move on to your neck. So, okay, so now I'm going to palpate your trachea. It's nice in midline, so that is perfect. Very good. Now I'm going to have you take a sip of water, and we're going to check your thyroid, looking for any nodules. So take one sip, and I'm going to go behind you. Make sure here. Okay. Now turn to the camera a little. There you go. Okay, I'm going to go ahead, swallow. Very good. Okay, take one more sip. Okay, swallow. Very good. So I don't notice any nodules. Everything is perfectly normal with your thyroid as far as I feel. Okay. Yeah, we checked the maxillary. I just double checking the maxillary, or excuse me, the frontal and the maxillary sinuses. And did you have any tenderness or anything with that?
No.
No, okay. I just wanted to make sure I got those. Okay, the next thing that we're going to do is we're going to, we're going to check your carotid, okay? So if you turn your head to the side a little bit, I'm going to feel for that. Very good. I'm going to feel the other side. 2+, very normal. Now I'm going to listen for it. I'm going to listen for any buoys, okay?
Okay.
Okay, use the bell on my stethoscope. Okay. Can you hold your breath for me, sweetie? Okay. Very good. I don't hear any bruise, so that's good. You don't want to have any bruise at your age. You're pretty young. Okay, now we're going to check your lymph nodes, okay? So I'm just going to palpate them, and you tell me if you have any pain or tenderness. So we got your post-auricle, your occipital, your post-cervicular, okay, your tonsillar, submandible, submental, your supraclavicular, infraclavicular. Can you sit back for me? I'm just going to feel right here, right here, through here. Did you know you have lymph nodes right there? That was called inguinal. Okay, I don't feel any, so that's very good. Now we're going to go like this, and then I'm going to try see if I can feel your epitrochlear. Very good. Everything was very movable, nothing noted, so that's good. So your lymph nodes are in good shape. Okay, so now that we did your lymph nodes and that, let's move on to our lung sounds, okay? Okay, so the first things first is our respiratory rate. Our respiratory rate is, it's an easy 18. I don't see any retractions, she's not having a tough time breathing at all. So there's no distress or anything like that. So I'm just gonna listen, posterior and anterior, and first up the diameter, the AP. It's a 1 to 2. She's got normal diameter too. So I'm gonna scoop my stethoscope in your shirt, okay? Okay, there we go. Nice deep breath. Okay, deep breath. Okay, now I'm gonna listen to your back. So you can turn your back to the camera. Perfect. And then I can listen easily. And I'm gonna scoop my stethoscope up the back of your shirt, okay? And I'm gonna do a ladder type fashion, okay? So back and forth. Okay. Back and forth. Okay. Very good. So I don't hear any adventitious lung sounds. That would mean any crackling or rails. You want to keep sit where you are, and I'm going to percuss. And when I hit dullness, that means that we hit your diaphragm, okay? And I'm going to do it in the same ladder type fashion. Okay, you ready? Here we go. We're doing good. So this is called percussing, and timpani is the sound that we hear. So when we get to the dull part, that tells us that we're either on an organ or something that maybe shouldn't be there, because your lungs are nice and hollow, so they make this nice sound. About right here, that's where your diaphragm starts, so that's very good. Now we're going to do the 99 test, which is the bronchophony. So what I'm going to do is you just keep saying 99, and I'm going to listen to you, but I got to go under your shirt, okay?
Okay.
So you just keep saying 99. Ready? Go.
99, 99, 99, 99, 99, 99.
Perfect. You can stop, Lillian. Very good. So the 99 sounded very dull. If it was sharp, that would maybe indicate that you would have pneumonia or something like that. But your lung sounds are clear, and your 99 is dull. So your bronchophony is really good. Okay. Okay. Let's see. I think we did everything for your lungs. Now we're going to look at your heart rate. Okay. So what I'm going to do is I'm going to have you lay back for me. Okay. And the first thing that we're going to do is we're going to check your jugular venous pressure. And I got to find my tools here. Here's my ruler. And I'm actually going to steal one pillow out from you. Can you sit up a little bit, sweetie? Okay, there you go. All right, now, whoop, missed you. Okay, head up. There you go. All right. And so we're going to look for your jugular venous pressure. So as I found your pulse here, and I'm going to mark it with my little card, okay? And then I just measure it. And it's like 2.5 centimeters. So that's normal because you're little and short. So your jugular venous pressure, that is good. Okay. So the next thing that we're gonna do is we're gonna look at your precordium. Oh, I'm gonna set this over here. So you can get the other pillow again, so you can sit up a little bit, sweetie. So I'm just gonna tug your shirt down just a little bit, okay? And I'm looking for any heaves or lifts visually. I don't see any heaves or lifts. Now I'm gonna palpate for any pulsations or any thrills. Okay, very good. Now I'm gonna oscillate. I'm gonna listen for your aortic, pulmonic, tricuspid and mitral valves, your S1 and S2, okay? That's the lub, dub, okay? That you hear. And I'm gonna use my diaphragm here. Okay, so aortic, second intercostal, right side. Okay, second intercostal, left side for my pulmonic. Very good. Now I'm gonna go up from the bottom to the fourth to find that tricuspid. Very good. And then I'm gonna go over to the fifth intercostal for that mitral. And now that I'm at the fifth intercostal, I'm going to feel for it, because that's your maximal pulse, your maximal point of pulse right there. So as I'm feeling for it, it's nice and strong, and I would stay in 60 seconds, and I would count for 60 seconds. But we already did that, and it was 98 beats. Okay, so that's very good. And it's 2+, normal and regular. Okay, so now we're going to check for any murmurs, okay? So I'm going to have you, let's see, go to your side. Can you turn to your left side for me? Yep. Okay. And I'm going to listen to your mitral valve. A little bit more to your side. Okay. I'm going to use the bell. And I'm going to up to fifth intercostal. Ready? Very good. Okay. And then I'm going to, I'm listening for any S3 or S4, but I don't hear any, so that's good, okay? Now I'm gonna have you sit right here. Now I'm gonna have you lean forward towards me a little bit, and I'm gonna have you hold your breath, and I gotta scoop my stethoscope up your shirt though, okay? Okay, you ready? Hold your breath. Very good. Now we're going to check your pulses. Okay. So I didn't hear any murmurs, by the way. So things are looking really good. Now I'm going to check your pulses. I'm going to check your temporal, your brachial, your radial. And scoot your legs out. We check your femoral. You've got good pulses here. Got a lot of blood getting into those legs. Very good. Popliteal, tibial, dorsal pedalis, down here. Very good. Your pulses are all strong and 2+. The next thing I'm going to do is I'm going to look to make sure you don't have any varicosity. So this is your peripheral. Just make sure you don't have any arterial insufficiency. You're pretty young for that, but we always got to check anyway. You don't have any varicose veins, and I'm looking for any swelling or any edema. Edema means swelling. So if I pushed and your skin stayed, then that would mean you were swollen, but you're not. There's no edema noted or anything like that. Okay, so now we're gonna go into, we're almost done. We're like 50% done. So let's check our abdomen. Okay, so lay down back for me. Okay. All right. Will you ticklish, Lil?
A little.
A little? Okay, I'll be careful. Okay, so now we're going to look at your tummy, okay? We're going to look at your abdomen. I'm looking at the contour. I'm looking for any masses or lesions or anything going on that would be abnormal. There's no redness, erythema, or any swelling. The next thing I'm going to do is I'm going to listen to your abdomen. Your bowel sound should be between 5 and 34. So let's see here. With the diaphragm, and I'm going to listen to all 4 quadrants. With the diaphragm, I got it here. There we go. Your bowel sounds are very normal and they sound good, between 5 and 34, but they're probably about 22, so that's really good. The next thing I'm going to do is, remember how we did our percussing on your back? We're going to percuss your tummy. So we may run into some dullness, but that might just be fecal matter or an organ. So we're just going to percuss around, okay? Any pain with that? No?
No.
Very good. Very, very good. Okay. One thing that we're going to do is I have to palpate. So we percuss, and now when I palpate, I'm going to palpate lightly and deeply. And you tell me if anything hurts, okay? We're going to palpate all 4 quadrants. Okay. And now I'm going to do a little deeper. Anything? Any pain or anything?
No.
Very good. Now we're going to find your liver, okay? So the same thing, we're going to use our percussion, and we're going to go up. And when I hit a dull spot, that's the bottom of your liver, and I'm going to mark that. We're going to go down, and when I hit the dull spot, that's where your liver stops. So usually the liver sound is between 6 and 12 centimeters. So, okay, I'm just going to scooch your short sound just a teeny bit. Okay, ready? We're going to do this mid-axillary. About right here. There's that. That's where we'll mark that. And then we're going to go from here, and we're going to go down. Yep. And it's about right there. Perfect. Okay. So that is where your liver is. And then we'll palpate it too. I'm going to come around here in the edge, the intercostal. Okay, I'm going to find that. Now I'm going to have you take a deep breath and out. And I'm feeling for that. Very good. So the edge of your liver is nice and demarcated, okay? Now we're going to move across to your abdomen, and we're going to look for your spleen. And we're going to look for any enlargement, because that would not be normal. And I'm going to percuss across, out here laterally, from medial to lateral. I don't hear any, I don't feel any enlargement, and it's percussing appropriately. Now the next thing that I'm going to do is I'm going to palpate for it. So I'm going to push real hard here and real hard here. Okay, take a deep breath. Now out. Very good. Feeling for your spleen, and it feels normal. I don't feel any enlargement or any problems with that. Okay, now the next part is, this is the good part. These are the special maneuvers. This would make to see if you have appendicitis. So I guess I do need this corner. Now remember, I'm going to push real hard and release, and that's called rebound tenderness. You ready? I'm push real hard, release. Any problems?
No.
Nope. Now I'm going to push on the left, and you let me know if it hurts on the other side.
Nope.
Okay, that's Rossing's, because it actually travels across. So you don't have any pain though? Very good. So those would be negative for appendicitis. There's a couple more appendicitis tests we got to check for just to make sure. This is called the psoas muscle and the arbiter. So I'm going to hold here and go ahead, push up on your leg. Remember, just push up like this and push against my hands. Oh, very good. You're strong. Okay, go ahead, put it down. Any pain with that?
Nope.
Nope. Okay, now we're going to bend your knee. Bend your knee. Very good. And like that. Any pain with that?
Nope.
Nope. Okay, so that's your arbiter muscle. And excuse me. And now if those would be aggravated, and those would maybe cause you pain. So you're negative for appendicitis. Very good. And I didn't see that you had any surgeries or any scars on your tummy either. So you haven't had any surgeries or any scars, right?
Mhm.
Right. Okay, very good. Okay, now that is your abdomen. Let's check your musculoskeletal. We're getting there. Come on. Sit up on the edge of the bed. Okay. Let's check your temporal mandibular. So open, close. Perfect. No clicks. Okay, now I'm going to feel your cervical spine and your paravertebral muscles. Very good. Everything feels good. Now we're going to check your range of motion. So I'm going to have you follow me with whatever I do, and I'm going to take my stethoscope off for just a minute here. Okay. Now, okay, so what we're going to do, no, you could sit on the bed, it's just fine. Okay? Whoop, you all right? Okay. All right. Okay, so now we're going to flex. We're going to extend. We're going to put our ear to our shoulder. lateral, lateral, side, side. Perfect. Any pain with that?
Nope.
Nope. Great. So that's your neck. Now we're going to go into your shoulders. We're going to find your AC joint, lateral humeral, and here's your bicipital groove, your big biceps. Very good. Other side, bicipital groove. Those are our landmarks. Now we're going to do our range of motion. And remember, there's a lot of range of motion with our shoulders because they're a very mobile joint. Okay? So first we're going to go out. We're going to abduct. Then we're going to adduct. Adduct. Okay, very good. Now we're going to go like this. Okay, football goalpost. So that's external rotation. Very good. Now behind our back, internal rotation. Very good. Now we're going to flex 90 degrees. 180. Very good. And extend behind us. Very good. Okay, so those shoulders are working perfectly. Now we're going to look at the humeral epicondyle right here, feeling for that, and the old cranium process, both sides. Any pain with that, sweetie?
No.
Okay, now we're going to do range of motion. You ready? Here we go. We're going to flex, extend. Okay, now we're going to open our hands. This is called supination, pronation. Supination, pronation. Perfect. Things are working good. Now we're going to move down to our wrists. And our wrists, we have the ulnar styloid and the radial styloid. Radial styloid. And your carpal bones. Very good. So those landmarks look good. Let's practice our range of motion. You ready? So we're going to extend, flex. Okay. Then we're going to deviate. Radial, ulnar deviation, radial deviation. Okay, very good. Okay, so those were perfect. Any pain with that?
No.
Okay, now we're going to look at your metatarsals. Very good. Metatarsals, everything feels good. Now I'm feeling your joints, your MCP joints, MCP, PIPs, and your DIPs, your distal interphalangeal joints. Yep. Oh, everything feels good. Now let's do our range of motion. Okay, we're gonna flex, extend, we're gonna abduct, adduct. Okay, now we're gonna take our thumb, we're gonna adduct, abduct, okay? And we're gonna flex, extend. Okay, now we're gonna do the opposition. Very, very good. Okay, so those are our hands. Now I'm gonna lay you back down and we're gonna do our pelvis. Okay, so I'm going to feel for your greater trochanter. Feels good. Any pain with that, sweetie?
Nope.
Nope. Okay, now scoot to the edge of the bed and we're going to practice our extension. Okay, I'm going to hold your hip. Now just go ahead, drop your leg. Very good. That extended very nicely. We would do this on both sides. Everything is always both sides, okay? But no pain?
Nope.
Okay, so now I'm going to hold your leg. I'm going to abduct. We're going to adduct. Okay, very good. And now we're going to flex your knee. There you go, flex your knee. Very good, because we did the extension. Now we're going to go internal rotation and external rotation. Any pain with that?
Nope.
Very good. Okay, so that's your hips. Okay, now scoop back here, aim for there, and I'm going to look at your knees next. Can you put your legs towards me? Very good. Okay, can you sit up though? Okay, all right. So let's look at your knees. We've got the femoral condyles, the tibial condyles, the lateral, medial. Okay, then we got your tibial tuberosities right through here. Okay, can you flex your knees up? We're gonna range of motion, flex and out, extend. Very good. Now we're moving into your ankles. Okay, so now we've got your ankles and your lateral malleolus, your medial malleolus. Any pain with that?
Nope.
Okay, let's flex towards your nose. Okay, extend towards me. Okay, we're going to evert away. Can you evert away? Very good. Invert towards you. Very good. Okay, now we are going to flex your toes. Flex your toes for me. And then we're going to open your toes. Okay, now we're going to spread your toes out and then close them together. Very good. So that's abduct and adduct. Okay, and then I have to, now the next thing I'm gonna do is feel your tarsals, toes and tarsals, they go together. And now I'm gonna feel your joints, okay? And I'm gonna feel your PIPs, your DIPs, your distal interphalangeal. Very good. Any pain with any of those?
Nope.
Okay, so can you curl your little toes? Curl them, yep, and extend them. Abduct and adduct. Okay, so now the next thing that we're gonna do is we do our toes. Oh, I think we're done with our muscle. Oh, we're almost done. You can scoot to the end of the bed. What I'm gonna do is I gotta look at your muscle mass, okay? Let's look at your muscle mass. Everything is good and even. I don't see any tremors, fasciculations, or any unusual movements. And now we're gonna check your motor. Let's start with your shoulder girdle. So put your arms out like this, flip them over, and shut your eyes. Very good. If something was wrong, they would drift or pronate, so that's very good. The next thing that we're gonna do is, remember, we're gonna go like this. We're gonna test your strength. Yep. So push against me, push towards me. Very good. Now push up. Okay. Now, very good. Now I'm gonna have you push your knees against me, push up. Okay. I'm gonna push out. Now I'm gonna push in. Okay. Very good. Now I'm gonna go down to your calves, push out, push in. Okay. Now I'm gonna have you pull your feet up, pull up, push down. Oh, very good. Okay, so your muscles are a 5+, so that is very good. Oh, one more thing, we're gonna do a hand squeeze, okay? So here's my fingers. Go ahead, squeeze my hands. Very good, equal bilaterally. Okay, now we're gonna do your sensory, okay? Now I'm going to take, we're gonna check your dermatomes. So here's mine. Ooh. We're gonna check this. Okay, I need this and this. Okay, so what I'm gonna have you do is I'm gonna have you shut your eyes, okay? And you tell me if this is soft or light, okay?
Sharp, light, 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 sharp.
Okay, very good. So that means all of your sensory is very, very good. The next thing I'm going to do is we're going to check your feeling with my tuning fork. So when I'm going to put it on your finger and you tell me to stop, okay? So tell me when, shut your eyes and then tell me when it stops.
Now.
Okay.
Now.
Very good. Okay, now I'm going to do it on your big toe, okay?
Now.
Other toe.
Now.
Okay, very good. Now we're going to do one more test. This is the positional test. So I'm going to have you put your finger out and then you close your eyes and you tell me if it's up or down.
Up. Down.
You got to talk louder, Lillian.
Down. Up. Down. Up. Up. Down.
Okay. So, now, so we've done your positional sense and your dermatomes. So now there's one thing that we didn't do. We didn't do your cranial nerve. So we got to run through those really fast, okay? So your cranial nerves. Cranial nerve 2 was your visual acuity. We did that with your eyes, so that was very good. It was the Snellen chest. You have perfect 20/20 vision. 3, 4, and 6 are the extraocular movements. Those were very good. Number 5 is a neat one. That's called your trigeminal. So we're going to use this. And where's my little Q-tip? Oh, here it is. Okay. So what I'm going to have you do is put this in your mouth and bite down. And I'm going to pull. In the other side. Pull. Okay. Very good. Okay. So we have, so that means that your motor is working perfectly. The other part is now I'm going to test, just like I tested the soft and sharp, I'm going to test that on your face. So shut your eyes.
Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp.
Okay, very good. So that means that your number 5, your trigeminal is working perfectly, your motor and your sensory. Now we're going to look at number 7. So smile for me. Okay. Now frown. Oh, that's very good. Frown. Okay, so that means number 7 is intact. Number 8 we looked at because that was your number 8 was your hearing, so your acoustics. So that was perfectly intact. 9 was your uvula. It rose up in midline. 10, yeah, that's 9 and 10. Now 11 is the shoulder shrug. Okay, so this is your spinal accessory. So push up against me. Okay, down. Very good. And now push to the side. Push your head to the side. Very good. Now push your head to the side. You turn your, I should say, turn your head to the side. I'm going to try to hold you. Very good. Your cranial nerve 11 works very good. Now stick out your tongue for number 12. Perfect. Midline. Awesome. Okay. All right. So we did your sensory. The next thing we're going to do is your deep tendon reflexes. We're almost there. We're almost done. Okay. Remember, hang your arm out like a scarecrow. Very, very good. So this is your tricep. Whoop. Very good. Now this is your brachial radialis right here, right? Your your bicep. Bicep. 1, 2. Whoop. Very good. Now your brachial radialis is right here. Whoop. Very good. Now your patellar. Very good. Now we're going to dorsal flex up. Very good. You have great tendon reflexes. Now scoot all the way back to the bed. Remember, we're going to do the bottom of your foot. Okay, see us. Okay. You can do the bottom of your foot. And this is the Babinski or plantar. So I'm going to go up. Does it kind of tickle? And over. Very good. So you're negative. Your toes did not span out. So if you're a baby up to 12 months old or even to 24, that would be okay. But grown-ups, that's not good. So you have a negative Babinski, which is perfect. That's what we want to see. Okay. All right, let's see. We've done our sensory. We have to do our cerebellum test. You're very good at this one. Okay, come back, sit down with me. Let's practice your movements. You ready? Okay, ready? Coordinate. So back and forth. Just follow me. Okay. Very good. Now swim like a fish. Whoop, whoop, sorry, sweetie. Okay. Swimming like a fish. Okay, so your coordination is very good. I am going to ask you 2 questions. Okay, you're going to like this. The cognitive function. Can you spell world backwards?
D-L-R-O-W.
Okay, very good. World backwards. Now, there's one more question. This is your higher intellectual functioning. Now, if you, if there was a burning building, what would you do?
Since the smoke goes up, you go to the ground and find the nearest exit.
Very good. Yep, very, very good. Okay, so that's your cognitive function. We're going to do one more cerebellar function, and that is checking your gait. So if you want to stand over here, oh, I dropped all this stuff here. You want to stand right here with me? Okay. And we're just going to walk 4 steps, and I'm just going to look at how you walk. Okay? 1, 2, 3, 4. Stop. Okay? Turn around. Now go heel to toe for me. So heel to toe. 3, 1. Okay. Very good. Okay, so that your heel to toe is perfect. Now one of the last tests we do is called the Romberg test. Okay? So now we're going to look at the camera. Look at the camera. Okay? Now you're going to put your arms, palms up like this. Okay, now for 20 or 30 seconds, I'm going to have you shut your eyes. Okay, go. And I would look for any swaying or any drifting, but you are solid. You have very good balance. So your cerebellum is working very good. Okay, go ahead, put your arms down. Okay, so you want to hop back up on the bed for me? All right, so let's double check to make sure that we got everything. We've listened to your heart, your lung sounds. We've looked at your skin, your hair, your eyes, your nose, your mouth. We've looked at your legs, all of your range of motion. Everything is working very good. Oh, your spine. Let's look at your spine. We didn't look at your spine. So we got to check for scoliosis. So come, hop down one more time. Okay, so turn around. All right. As we're looking at your spine, we're checking out, and I'm feeling your vertebrae. I'm looking here for your sciatic notch. That's very good right there. Is there any pain or tenderness there?
Nope.
Okay. I don't see any lordosis or kyphosis. But for the scoliosis testing, we're going to turn to the camera. We would have you bend over for me. Just go ahead, bend over. And it's best without a bra and stuff. But we would look for any S curvatures of the spine. But Lillian's is nice and straight in midline. And I don't see any abnormalities with her hips. So her spine is good. Her paravertebral right through here is very good. Okay, you want to hop back up? And I think we got everything that we needed to do. We got your lymph nodes, we've got your eyes, your nose, your mouth, your ears, your throat, your heart. You don't have any murmurs. You got a couple skins under your knee, and that's it. You're very healthy. We got your percentiles. We just got, make sure you go to the dentist, and twice a year. Always wear your bike helmet when you're riding bike. Be healthy, safe. As far as nutrition, remember, stay hydrated and keep away from the junk food. Great? Great.